My name is Dr. Elie Klein. I'm a doctor of naturopathic medicine. I specialize in treating risk factors related to cardiovascular disease. I'm the author of 3 books, Read This If You Have a Heart, The Dangers of Low Cholesterol, and The Ultimate Guide to Beautiful Skin, Hair, and Nails in 90 Days. I'm also the formulator with Nationalnutrition.ca and MHS, my health supplements. Many people come to me seeking guidance with elevated cholesterol levels. They want me to help them reduce cholesterol, elevated cholesterol naturally. They do it because they're concerned about adverse effects related to cholesterol-lowering medication. But it's really, really important to understand that cholesterol isn't a harmful or toxic substance. It's really important to change our mind about cholesterol and understand what it is and what's a healthy way of addressing it. Cholesterol is the substance the body produces and produces for a reason. It helps produce cholesterol itself, is needed for the production of stress hormones, of bile that is used for digestion, of fats. 25% of it is in our nervous system, where it plays an important role in nerve conduction and the function of the nervous system. It's an important part of the cell where it plays a role in the actual structural integrity. So it's the cellular skeleton of the cell, so it helps to hold the cell together. It is needed for the absorption of nutrients such as glucose and so on. So cholesterol is really, really, really important. It's also interesting that studies have shown that most people who have a heart attack have normal cholesterol levels when they get the heart attack. More specifically, I'm referring to a study that was published in the American Heart Journal 2009, which followed more than 136 heart attack patients. And then there are many other studies that show that people, especially over 60, with the lowest cholesterol levels tend to have poor health and tend to have a lower life expectancy than those with normal or even high cholesterol levels. So it's really, really important to perhaps stop chasing cholesterol as a culprit for cardiovascular disease, because it's not. However, what's interesting is that people of poor health tend to produce elevated cholesterol for reasons that are associated with cardiovascular disease. So let me explain that. Common reasons for cardiovascular disease that may result in higher cholesterol levels include insulin resistance, include stress, hypothyroidism, and deficiency of certain nutrients like vitamin C and magnesium. And so all these conditions directly contribute to elevated cholesterol levels, but it's not that cholesterol itself causes cardiovascular disease. It's these other conditions that directly relate to cardiovascular disease. And so just slashing cholesterol indiscriminately isn't necessarily going to protect your arteries. Again, 72% of people who have a heart attack have normal cholesterol in their blood. And so it's really, really important to address these underlying conditions. And so in order to help you understand this more clearly, I've written and launched a book called The Dangers of Low Cholesterol. In my book, I talk about the uses and functions of cholesterol in your body in more detail. I talk about the various studies on cholesterol, the various studies and the evidence showing that cholesterol is not the culprit in cardiovascular disease. I also explain why doctors chase cholesterol and what's wrong with that, and I provide you with the evidence. I also talk about the various causes of elevated cholesterol and how you can address the underlying causes of your elevated cholesterol levels safely and naturally.